This video is for informational and educational purposes only. It does not constitute medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before starting, stopping, or changing any prescription medication. Picture this: 6 weeks into a regimen of Ozempic. The nausea has faded, the scale moves, your doctor is pleased. Friends remark, and then, subtly at first, something shifts. Not in your body, so much as in how you inhabit the world. Your favorite restaurant tastes different. A birthday dinner feels oddly hollow. Food begins to feel like it belongs to someone else. Nobody prepared you for that moment. Not the nausea, not the hair in the shower drain, not the strange emptiness at a holiday table. This video maps the real side effect picture, the common symptoms everyone knows, the ones people forget to mention, and the psychological changes most videos entirely skip. Before we get into specifics, a brief explanation of what semaglutide, the active ingredient in Ozempic, is actually doing. Your body produces a hormone called GLP-1. Each time you eat, GLP-1 rises in short, meal-triggered pulses. It tells your brain you are full, slows stomach emptying, and helps regulate blood sugar. Semaglutide mimics that hormone, but it does so more strongly and for far longer. Instead of minutes, its effect stretches for days. That sustained elevation of GLP-1 is why the medication is effective and why side effects occur. You are, in effect, running a system your body designed for brief signals continuously, 24 hours a day, 7 days a week. Once you understand that mechanism, many side effects begin to make biological sense. First, the gastrointestinal effects. Nausea, constipation, vomiting, and diarrhea are the ones everyone mentions. They affect roughly half of users during the early weeks. They are real and unpleasant. Most people mitigate them with slow dose escalation and simple dietary adjustments, smaller portions, reduced fat content, and spacing meals farther from lying down. Hydration and bland foods help during acute nausea. These problems are not trivial, but for many they subside with time. Still, they are rarely the most surprising consequences. This next section matters, so pay attention. First, muscle loss. Increasingly noted by clinicians and increasingly underemphasized in public discussions, muscle loss accompanies rapid weight reduction. Weight lost on semaglutide often includes a substantial proportion of lean tissue, in some analyses, up to 40%. For younger adults, this may appear cosmetic. For older adults, it is a significant metabolic and functional concern. Muscle regulates glucose, preserves strength, and supports skeletal integrity. Losing muscle mass, therefore, undermines the very health outcomes many are pursuing. The remedy is not mysterious. Resistance training and attention to adequate protein intake are essential. If your clinician did not flag muscle preservation on day 1, you may be losing tissue you do not see on the scale. Start lifting. Prioritize protein. This is not optional. Second, hair loss. Telogen effluvium, a pattern of diffuse shedding triggered by physiological stress, is consistently reported by users and consistently underemphasized. The medication may not directly attack hair follicles. Rather, the rapid weight loss constitutes a stressor that pushes follicles prematurely into the shedding phase. The timing is predictable. Most people notice shedding 2 to 4 months after the weight loss begins. It usually resolves spontaneously, but the experience of finding hair in the shower or on a pillow without warning is distressing. Being informed prepares you for a temporary setback rather than a shock. Third, the so-called Ozempic face. The phrase may sound tabloid, but the underlying biology is straightforward. Rapid weight loss depletes fat stores across the body, including mid-facial fat that provides youthful volume. The result in some users is a gaunter, older appearance as facial fullness diminishes. Dermatologists are seeing this more frequently. Many patients are surprised because the face is visible to everyone, and its change can feel disproportionately large emotionally. If aesthetic outcomes concern you, discuss options with a clinician before beginning therapy. Fourth, the rebound.
This consequence carries profound practical implications. Semaglutide modifies appetite and satiety through its GLP-1 activity, but it does not rewrite the underlying physiology that predisposed a person to prior weight. When the medication is stopped, the pharmacologic GLP-1 signal returns to baseline. Hunger typically returns.
Studies indicate that most individuals regain a substantial portion of lost weight within a year of discontinuation. Financial realities amplify this problem. The medication in many markets costs $900 to $1,300 per month without insurance. For someone contemplating a finite course to lose 15 pounds, the economic and physiological calculus differs dramatically from someone using the drug to manage obesity-related disease long-term. This is not a verdict against the medication. Rather, it is a reason to clearly understand what long-term or indefinite use might involve. Finally, the rare but serious risks. Animal studies flagged a potential association with medullary thyroid carcinoma, which underpins the medication's black box warning. Cases of pancreatitis have been reported. Acute kidney injury has occurred as a secondary consequence of severe dehydration from prolonged nausea and vomiting. These outcomes are uncommon, but they are real, and they underline the fact that semaglutide is a potent prescription medication, not a benign supplement. A comprehensive discussion with your physician should include these possibilities and the monitoring strategies to detect them early. Now, the psychological side effect, the part most videos skip. Food is rarely only fuel. For many people, eating has been comfort, ritual, and social language. It is how families celebrate, how friends connect late at night, and how individuals soothe stress. When semaglutide quiets the biological drive to seek food, described by many as the food noise going silent, something beneath the surface emerges. For some, that silence is a relief. Eating no longer dominates daily decisions. For others, it is disorienting, almost grieving. Social interactions change. You may leave celebrations feeling physically satisfied, but emotionally distanced. You may find yourself uncertain what to do with spare time that used to belong to snacking or emotional eating. Mental health professionals increasingly recommend counseling as a companion to GLP-1 therapies, not because the medication is harmful in a psychiatric sense, but because a profound physical change frequently carries emotional weight that benefits from intentional processing. Counseling can help you translate the absence of one coping mechanism into the presence of alternatives. So, how should you weigh these effects? The honest answer? They are items in an equation, not a single sentence that decides everything. For patients with significant cardiovascular risk, type 2 diabetes, or obesity-related complications, the clinical evidence is robust. One major cardiovascular outcomes trial demonstrated a roughly 20% reduction in major adverse cardiovascular events among high-risk patients. That is meaningful and life-altering for some. Conversely, for an individual seeking modest weight loss for cosmetic reasons, the cost, the side effect profile, and the likelihood of needing long-term therapy change the balance. The people who derive the most durable benefit from this medication treat it as one tool within an integrated approach. Resistance exercise to protect muscle, adequate dietary protein to preserve lean mass, psychological support to integrate the emotional changes, and careful medical monitoring to identify rare but serious complications early. Used in that context, semaglutide can be transformative. Used without that context, the experience is incomplete. If this overview gives you a clearer picture than you had 10 minutes ago, consider sharing it with someone who is considering the medication or who is already on it and wondering why they feel different. If you are on semaglutide, bring these points to your next medical visit. Ask about strategies to preserve muscle, discuss the likelihood and timing of hair shedding, and prepare for the psychological adjustments that may follow. If you are considering stopping the medication, plan ahead, engage medical advice, consider behavioral supports, and anticipate the potential for weight regain so you can design a sensible transition plan. Drop a comment describing which side effect surprised you most, or what you wish someone had told you before you started. New video every week. See you in the next one.